Let's talk about the terminology providers use when talking about bipolar disorder. First of all, there's the distinction between mania and hypomania. The difference between a hypomanic episode and a manic episode actually has to do with how disruptive the symptoms are. They're the same exact symptoms, it's just how severe they get. And the line that distinguishes them has to do with whether the symptoms are impacting your life negatively or not. So a hypomanic episode is the same symptoms, but they're still mild enough that they might actually be enhancing your performance. A manic episode is when those same symptoms have escalated to a point that they're really getting in the way of your functioning, so that what you're doing or your behavior is becoming destructive or otherwise regrettable. One thing to know is that bipolar disorder used to be known by the name manic depression. So if you heard someone had manic depression, it's the same thing. Another term providers use sometimes is the word euthymic. Everybody has a different range of highs and lows, so it's not something that is technically definable. Euthymic just means what is your version of normal. Another thing to know is that depression as a diagnosis is called a major depressive episode. Psychosis in bipolar disorder can occur both when people are depressed or when people are manic. Psychosis basically means either delusions or hallucinations. In the case of delusions, that means believing something that isn't actually true. Hallucinations are sensory perceptions. So those are things that we perceive with our five senses, things that we see, things that we hear, things we feel, smell, or taste. Another term you'll hear sometimes is called rapid cycling. And sometimes people think of that as your mood going up and down, up and down, up and down. Rapid cycling is when you have 4 or more mood episodes in a given year. Mood episodes are periods of time, 2 weeks in length or more for depression, or several days at once for a mood elevation, and you have to have 4 or more of those in a given time. Hopefully, familiarity with this terminology can help you communicate with your providers and learn more about bipolar disorder.